Welcome back to Cat Rules, and welcome to what may be the most difficult part of this entire series. In parts 1 through 8, we built the foundation for a healthy cat in a healthy home. We covered feeding decisions, medical prevention, training, enrichment, and environmental design. All of that foundation was built for one reason: to give your cat the best possible life throughout their years. But inevitably, that life reaches a final chapter, and the decisions you make during that chapter determine whether your cat experiences dignity, comfort, and peace, or whether your cat experiences suffering, confusion, fear, and an ending that haunts you with guilt and regret. The hardest conversations about cat ownership are not conversations you have with your cat. They are conversations you must have with yourself. How much treatment is appropriate? When is treatment no longer helping but merely prolonging suffering? How do you recognize pain that your cat cannot tell you about? How do you know when your cat is ready to die? How do you let go of a being that has been the constant in your life, sometimes for 15, 18, 20 years? These are not academic questions. These are the questions that wake you at 3 in the morning, months after your cat is gone, asking if you did everything right, if you did enough, if you did too much. Part 9 addresses these questions through 10 fundamental decisions that aging and chronically ill cats face and that their owners must make. These decisions span recognizing pain, managing appetite loss and litter box problems, adapting environments for mobility loss, supporting cats with sensory decline, deciding how much medical intervention is appropriate, managing multi-cat households when one cat is dying, arranging care at the end of life, and navigating the grief that comes after. These are not happy topics. This is not feel-good cat content. This is the real work of cat guardianship, the part that tests your character and your compassion, the part that determines the legacy you leave with your cat's memory. If you have a senior cat, if you have a cat with chronic illness, if you have ever wondered whether you did right by your cat at the end, this part is for you. The decisions you make now, while your cat is healthy, shape how your cat's decline will look. Will you have a plan, or will you face crisis? Will you understand what suffering looks like, or will you miss signs your cat is in pain? Will you feel at peace with your decisions, or will you be haunted by wondering if you should have done differently? These are not theoretical questions for most cat owners. These are questions that become suddenly, urgently real. Before we dive into the 10 decisions, I want to be clear about something. In parts 1 through 8, we talked about best practices, evidence-based recommendations, and optimal approaches. In part 9, we are not talking about best practices because there are no best practices for dying. We are talking about your values, your capacity, your specific cat's specific situation, and the dignity of a life ending exactly as that life should end for that specific being. There is no right answer that applies to all cats. There are only answers that are right for your cat and for you, and answers that you can live with, knowing you did your best with the information you had and the resources you could provide. If you are struggling with end-of-life decisions with a cat right now, you are not alone. If you have made choices that you now regret, you are not alone. If you are wondering whether you did enough, you are not alone. Every cat owner who loves their cat faces these questions eventually. Some of us face them unprepared. Some of us face them with guilt. Some of us navigate them with grace because we have thought about them in advance, because we have clear values about what a good death looks like, because we have given ourselves permission to prioritize our cat's peace over our own need to keep our cat alive. That is what part 9 is about, not keeping your cat alive at all costs, but helping your cat die well, helping you recognize when keeping your cat alive is no longer kind, helping you understand the signs that your cat is suffering, helping you make peace with decisions that are heartbreaking because they are the most loving decisions you will make. Let's talk about these 10 decisions that shape your cat's final chapter and your memory of that chapter. And if you love your cat, please watch this part all the way through, because the knowledge here may determine the difference between your cat experiencing dignity at the end or experiencing unnecessary suffering because you did not know what to look for. Comparison 1. quality of life focus versus aggressive medical intervention versus euthanasia timing. The fundamental question that guides all end-of-life decisions is what you are trying to accomplish. Are you trying to extend your cat's life at whatever cost, trying to maintain quality of life while that life continues? Or are you trying to ensure that your cat's life ends with dignity and minimal suffering, even if that means ending life sooner rather than later? The approach you choose to this central question determines every decision that follows, determines how you interpret your cat's behavior and symptoms, determines what treatments you pursue and which you decline, and ultimately determines whether your cat's final days are extensions of a life well lived or prolonged suffering that benefits nobody. This comparison examines what each approach actually means, what the outcomes are from each, what the ethical considerations are, how to recognize when your cat is actually suffering versus when you are projecting your own fears onto normal aging, and how to make decisions that align with your values while honoring your cat's actual needs. Let's start with the quality of life focus approach and what it means. Quality of life focus means prioritizing your cat's comfort, contentment, and enjoyment of remaining life over extending lifespan. The goal is not to cure disease or achieve perfect health, but to manage symptoms in ways that allow the cat to enjoy eating, moving, interacting with loved ones, and experiencing pleasure for as long as reasonably possible. When quality of life declines below a certain threshold, the goal shifts to providing peaceful death rather than prolonging survival. The comfort priority of quality of life focus means that pain management becomes essential, that treatments causing significant side effects or stress may be declined in favor of simpler supportive care, and that the cat's experience of daily life takes priority over medical optimization. A cat managing kidney disease without treatment but feeling good may be prioritized over a cat on aggressive treatment, feeling sick and anxious. The dignity consideration in quality of life approach includes that the cat is allowed to be a cat, not treated as a medical project. If treatment prevents the cat from engaging in normal behaviors, from interacting with family, from enjoying food or comfort, the treatment may be declined in favor of allowing the cat to live their actual life, even if shorter. The emotional benefit for owners choosing quality of life focus is that there is less guilt about not doing enough, because the focus is consciously on what truly matters to the cat's experience, not on pursuit of survival at all costs. When the time comes for euthanasia, owners who chose quality of life focus often feel more at peace because they know their cat's final days were comfortable and engaged. The acceptance requirement is that quality of life focus requires accepting that your cat will die, sometimes sooner than could be medically extended. This acceptance does not come easily for owners who have fought to keep their cats alive for years or decades. It requires letting go of the fantasy that medical intervention will solve the problem and accepting mortality. The end-of-life clarity that quality of life focus provides is that the goal and the endpoint are clear. When quality of life falls below what can be managed comfortably, the decision to pursue euthanasia aligns with the values that have guided all previous decisions. The decision feels consistent rather than like defeat. Now let's examine aggressive medical intervention and what it involves. Aggressive medical intervention means pursuing every possible treatment, every possible diagnostic test, every possible management strategy to extend life regardless of quality, cost, or side effects. The goal is to fight disease, to cure when possible, to manage and extend when cure is not possible, and to avoid accepting death as a reasonable outcome. The lifespan extension of aggressive intervention can add weeks, months, or occasionally longer to a cat's life. For owners who measure love by how long they keep their cat, alive, aggressive intervention reflects their values and their commitment. The survival focus of aggressive intervention means that quality of life becomes secondary to continuing life. A cat on medication causing nausea, disorientation, or stress is still fighting and still alive. The cat's emotional state matters less than the fact that they are surviving. The medical burden of aggressive intervention includes that cats must undergo repeated veterinary visits, blood draws, medications with side effects, and treatments that are stressful and disorienting to seniors who do not understand why they are being handled and manipulated repeatedly. The cost consideration is substantial because aggressive intervention typically means regular specialist visits, medications, diagnostics, and sometimes hospitalization. Costs can reach thousands of dollars for weeks or months of extended survival. For owners with limited resources, this approach becomes impossible. The guilt paradox is that aggressive intervention sometimes creates guilt rather than preventing it. Owners pursuing every possible treatment may feel they are torturing their cat, may see their cat suffering and feel they are extending that suffering, and may ultimately face the same euthanasia decision, but with the cat in worse condition, having endured months of treatment preceding the end. The false hope risk is that aggressive intervention often cannot deliver what owners hope for. A treatment that extends life 1 month may be pursued in hopes of longer extension, only to fail when cancer progresses or organ failure accelerates. The cycle of hope and disappointment repeats with each failed intervention. Now let's address euthanasia timing specifically. Euthanasia as a decision is the intentional ending of a cat's life when suffering becomes unmanageable or quality of life becomes unacceptable. This is not a failure of treatment or a giving up on the cat. This is the final act of love when the cat can no longer experience acceptable quality of life. The timing question is the hardest aspect because euthanasia decisions occur in a narrow window, too early, and you end a life that could have continued with good quality. Too late, and you have extended unnecessary suffering. The timing that feels right often depends on recognizing signs of unmanageable decline that owners often miss or misinterpret. The relief that comes after appropriate euthanasia is profound and surprising to owners who expect guilt. When a cat is clearly suffering, when their quality of life is unmistakably gone, when you make the decision to end suffering rather than extend it, there is often relief alongside grief. The knowledge that your cat is no longer suffering creates peace that persists through the grieving process. The regret that comes after delayed euthanasia is the opposite. When you waited too long, when your cat suffered unnecessarily, when the cat finally died after weeks of decline, the guilt can be overwhelming. Many owners report that they waited precisely because they felt they should exhaust all options, not because the cat was still experiencing acceptable quality of life. Let's examine how to recognize when each approach is appropriate for your situation. Quality of life focus is appropriate when you have realistic understanding of your cat's condition and prognosis. Your cat's suffering can be managed through comfort care. You can accept that life will end and prioritize the time remaining. You value your cat's emotional experience and normal behavior. The cost of aggressive intervention is prohibitive. Your cat shows they do not want invasive treatment through their behavior. Aggressive medical intervention is appropriate when your cat has a treatable condition with reasonable prognosis. Your cat is young enough that extended survival is realistically possible. Your cat's behavior indicates they are willing to undergo treatment. You have resources to pursue intervention without financial devastation. The treatment has reasonable chance of substantially improving quality of life. You have genuine hope that intervention will create more time for your cat. Euthanasia is appropriate when your cat is suffering in ways that cannot be managed with comfort care. Quality of life has declined below what can reasonably continue. Your cat shows clear signs of wanting to die, hiding, refusing food, extreme distress. Continuing life requires constant veterinary intervention without improving quality. Your cat is no longer a cat but a medical patient. The benefit of extended life does not justify the suffering required to extend it. The verdict. Quality of life focus provides the most peace at end of life because the goals are clear, the choices are consistent, and the endpoint is accepted before the final days arrive. This approach requires accepting mortality, but provides dignity. Aggressive medical intervention can extend life and may be appropriate for cats with treatable conditions and reasonable prognosis, but often creates suffering and guilt when applied to end-stage disease where extension is not possible. Euthanasia is not failure or giving up. Euthanasia is the final and often the most compassionate decision a cat owner makes because it ends suffering that cannot be managed otherwise. The decision about which approach is right for your cat should be based on your cat's actual condition, your cat's actual quality of life, not on how long you want to keep your cat alive. The two are not the same thing. Before your cat is dying, think about what quality of life means to you and your cat. Define what acceptable quality looks like. Define what unacceptable suffering looks like. Write it down if necessary. Then when end-of-life decisions come suddenly, you will have clarity about your values rather than making emotional decisions in crisis. If your cat is currently facing end-of-life decisions and you are uncertain which approach is right, ask your veterinarian to help you assess your cat's actual quality of life, separate from your emotional need to keep them alive. A good veterinarian will help you see clearly what your cat is actually experiencing, rather than letting you project hope onto a situation that is genuinely hopeless. The approach you choose will shape your cat's final days and your memory of those days. Choose based on what is truly best for your cat, not based on guilt, not based on what you think you should do, not based on what others would do. Choose based on knowing your cat, understanding their actual experience, and having the courage to make the decision that truly serves their well-being, even when that decision is heartbreaking. Comparison 2. Recognizing subtle pain signs versus assuming cat is comfortable. The most significant barrier to appropriate end-of-life decision-making is that cats experience pain silently, and owners are unprepared to recognize pain that their cat is deliberately hiding. Cats are prey animals whose survival in the wild depends on not revealing weakness or pain to predators. This instinct persists in domestic cats even when they are safe, creating a situation where your cat can be experiencing substantial pain while appearing to sleep peacefully. The contrast is between owners who develop the specific skill of recognizing subtle pain indicators that cats display, and owners who assume their cat is comfortable because the cat is not vocalizing or displaying obvious distress. This comparison examines what pain looks like in cats, which signs are often missed or misinterpreted, what assumptions owners make that prevent accurate pain assessment, how to objectively evaluate whether your cat is comfortable, and how failure to recognize pain affects end-of-life decisions. Let's start with why cats hide pain and what that means for assessment. Pain hiding in cats is an evolutionary adaptation that persists in domestic animals. In the wild, showing pain means becoming prey. Cats who clearly display pain or weakness are targeted by predators. The cats who survive and reproduce are the ones who hide pain most effectively. This instinct does not disappear when a cat moves into a home. A domestic cat in pain will still hide that pain as an instinct, not as a choice. The consequence of pain hiding is that pain assessment in cats cannot be based on obvious behaviors, like whimpering, limping, or asking for help. Many cats experiencing severe pain show minimal behavioral change. They continue to appear calm and peaceful while experiencing pain that would have humans screaming. This creates a critical gap between a cat's actual experience and the owner's perception of that experience. The behavioral compensation that cats use includes that cats will rest more, will move less, will be in positions that protect painful areas, will avoid activities they previously enjoyed, but will do all of this quietly without obvious signs of distress. A cat with arthritis pain will simply stay in bed rather than jumping to favorite spots. An owner seeing the cat peacefully resting may have no idea that the cat is avoiding movement because movement causes pain. The owner assumption problem is that owners frequently assume lack of obvious distress means absence of pain. A cat is quiet and resting, so the cat must be comfortable. A cat is eating, so the cat must be fine. A cat is not crying or acting distressed, so there is nothing wrong. These assumptions are dangerous and frequently incorrect. The pain recognition skill requires learning to see subtle indicators that owners without training completely miss. This is not natural knowledge that comes from loving your cat. This is specific knowledge that must be learned through education or through working with a veterinarian experienced in recognizing feline pain. Let's address the specific subtle pain signs that owners typically miss. Posture changes are the most reliable pain indicators, but are frequently missed. A cat in pain will position themselves to protect painful areas. A cat with abdominal pain will hunch or will have a tense abdomen. A cat with spinal or arthritis pain will hold their back in a rounded position. A cat with back leg pain will rest with back legs stretched out rather than tucked under. Owners see these positions and interpret them as normal sleeping positions rather than pain compensation. Activity reduction that is gradual and subtle is frequently misattributed to normal aging. A cat who previously jumped to high perches now stays on lower furniture. The owner thinks the cat is simply less active due to age. What they are not recognizing is that jumping causes pain and the cat is avoiding pain, not just being lazy. The activity reduction is pain-driven compensation, not normal aging. Grooming reduction or abnormal grooming patterns indicate pain. Cats experiencing pain in specific areas will avoid grooming those areas or will groom excessively those areas. A cat with arthritis in the back legs may not groom their hindquarters. An owner seeing a less groomed cat may simply think the cat is aging and not grooming as well. What they are missing is that the lack of grooming is because grooming those areas causes pain. Appetite changes including eating more slowly, taking smaller amounts at a time, leaving food that was previously eaten completely, or dropping food and leaving it uneaten often indicates pain in the mouth or throat or gastrointestinal pain. Owners see reduced eating and assume normal aging or illness, but do not connect it to oral pain from dental disease or other mouth problems that are very common in senior cats. Litter box changes, including difficulty entering or exiting the box, spending extended time in the box straining, or elimination outside the box, frequently indicate pain. Arthritis pain makes it difficult to get in and out of deep boxes. Digestive pain makes the cat spend extended time trying to eliminate. Owners see litter box problems and think behavioral issues or urinary infection, but do not recognize pain as the underlying cause. Behavioral withdrawal, where previously social cats become withdrawn, hiding more, interacting less with family, or avoiding being touched, frequently indicates pain. A cat who wanted lap time and now avoids it may be in pain exacerbated by movement or by being handled. An owner may interpret this as mood change or as the cat becoming aloof with age, without recognizing that the withdrawal is pain-driven. Changes in sleep patterns, including sleeping more than the typical 12 to 16 hours normal for cats, or sleeping in unusual positions that protect painful areas, indicate pain. A cat sleeping 20 hours daily is not resting peacefully. A cat is often unable to find comfortable positions and is exhausted from discomfort. Vocalization's changes may be increased but often are decreased. Cats in pain sometimes become very quiet. They vocalize less, interact less, become almost invisible in the home. Owners miss this because they are expecting vocal distress and are not finding it. Facial expressions change in subtle but observable ways. A cat in pain often has a slightly pinched facial expression, slightly flattened ears, slightly squinting eyes, or tension around the mouth. These changes are subtle and easily missed, but indicate underlying discomfort. Now let's address why owners make pain assessment errors. The emotional barrier is that recognizing pain means acknowledging that your cat is suffering. Acknowledging suffering means confronting the reality that your cat may need to die. Many owners unconsciously avoid recognizing pain because recognizing it requires making difficult decisions. It is easier to not see pain than to see pain and have to act on it. The guilt trigger is that recognizing pain often triggers guilt about whether you caused the suffering through past decisions or through not recognizing the pain sooner. This guilt is unproductive and prevents clear thinking, so owners may unconsciously dismiss pain to avoid guilt. The attachment factor is that the longer your cat has been with you, the more difficulty you may have in acknowledging that they are suffering. You do not want to see it. You have unconscious motivation to not see it. The normalization of aging means that owners expect senior cats to be less active, to sleep more, to eat less, and may normalize pain behaviors as normal aging rather than recognizing them as pain-driven. This normalization is understandable, but dangerous because it prevents appropriate pain management. The lack of knowledge is that many owners genuinely do not know what feline pain looks like. They have never been educated about subtle pain signs. They expect pain to look like what pain looks like in humans or dogs. They are looking for the wrong indicators and missing the right ones. Let's examine how to improve pain assessment. Objective assessment methods include body condition assessment, where you evaluate whether the cat is maintaining healthy weight or becoming thin, movement assessment, where you observe whether the cat moves smoothly or with stiffness and limited range of motion, and behavioral inventory, where you document the cat's specific behaviors and look for changes from baseline. The pain scale approach includes learning veterinary pain scales that assess pain through observation. Resources like the UNESP Feline Pain Scale provide structured assessment methods that are more objective than vague impression. The baseline documentation means that early in your cat's aging or chronic illness, you document what normal looks like for that specific cat. This baseline allows you to recognize meaningful changes rather than wondering whether a behavior is normal for this cat or represents change. The video documentation of your cat's movement and behavior can be helpful for veterinary assessment. A veterinarian can sometimes see pain indicators in video that are not obvious in verbal description. Video also provides objective record of change over time. The veterinary partnership is essential because a good veterinarian who knows your cat can assess pain better than you can. Regular check-ins with a veterinarian experienced in senior cat pain assessment means pain is identified early and managed rather than being missed entirely. The pain management conversation with your veterinarian should include explicitly asking whether pain is present and whether pain is being adequately managed. Do not assume that if pain were present, your veterinarian would have mentioned it. Explicitly ask about pain assessment and pain management options. The verdict, cats hide pain, effectively making pain recognition a skill that must be learned and practiced, not something that comes naturally from loving your cat. Assuming your cat is comfortable without specific objective assessment of pain is dangerous and often incorrect. Cats experiencing significant pain can appear outwardly peaceful. The solution is combining knowledge of subtle pain signs, objective assessment methods, and veterinary partnership to recognize pain that your cat would not tell you about if left to your own observation. If your senior cat has changed behavior, reduced activity, changed grooming, changed eating, or any other significant change, do not assume it is normal aging. Ask your veterinarian to assess pain specifically. Do not describe the behavior and wait for the veterinarian to identify pain. Explicitly ask, "Is my cat in pain?" How would you rate their pain level? Pain management is one of the most important aspects of end-of-life care. Many cats can be kept comfortable with appropriate pain medication. If your cat is experiencing pain, managing that pain becomes the priority in quality-of-life decisions. If you recognize pain in your cat and that pain cannot be adequately managed, that is the signal that quality of life is declining. It is the signal that the threshold for end-of-life decisions may be approaching. Pain that cannot be managed is incompatible with acceptable quality of life. The most common regret among owners at end of life is not recognizing pain sooner. Do not be that owner. Learn to see what your cat cannot tell you. Your ability to recognize subtle pain signs may be the most important thing you do for your cat in their final years. Comparison 3. Appetite loss. Force feeding versus accepting natural decline. As cats approach end of life, appetite loss is nearly universal and is actually a normal and natural part of the dying process. Food is fuel for survival, and when the body is shutting down, the need for fuel decreases. The loss of appetite is a signal that the body is beginning to surrender, not a medical emergency that must be prevented at all costs. Yet appetite loss triggers intense emotional responses in owners who equate eating with living and who interpret refusal of food as rejection of life-prolonging treatment. The contrast is between owners who attempt to maintain nutrition through force feeding, appetite stimulants, and supplemental nutrition despite the cat's disinterest, and owners who recognize appetite loss as a normal part of dying and accept that eating may no longer be important to the cat's experience. This comparison examines what appetite loss means, why it occurs, what force feeding actually accomplishes, what the costs of forced nutrition are, when nutritional support is appropriate versus when it becomes prolonging of suffering, and how to navigate the intense emotions that arise when your cat stops eating. Let's start with why appetite loss occurs and what it actually means. Appetite loss in end-stage disease occurs because multiple systems are failing simultaneously. Metabolism is slowing, the digestive system is declining, the brain is often less interested in eating as organ function declines. Kidney disease, cancer, heart disease, neurological decline all cause loss of appetite as part of the body's shutdown process. Appetite loss is not a symptom to be corrected. Appetite loss is a symptom that announces that the body is dying. The biological purpose of appetite loss at end of life may be that continued eating would cause additional suffering. Eating when the digestive system is failing causes discomfort, nausea, and gastric distress. Lack of appetite may be the body's protective mechanism against additional suffering. Forcing food past this protective mechanism causes the very suffering it is preventing. The normal versus abnormal distinction is important because appetite loss in a young cat with acute illness may be abnormal and may signal something treatable. Appetite loss in an old cat with known terminal disease is normal and is not something to prevent but rather to accept and manage. The emotional interpretation is that owners often interpret appetite loss personally. The cat is refusing food that I am offering means the cat is giving up. The cat is rejecting me. The cat does not want to live. This interpretation is incorrect. The cat is simply experiencing loss of appetite as part of natural dying. It is not rejection. It is not communication. It is biology. The owner's response is often driven by the feeling that if the cat stops eating, the cat will die faster. The owner tries to maintain eating as a way of prolonging life, but the correlation is backwards. The cat is losing appetite because the body is dying. Forcing eating does not extend life, but may extend suffering. Now let's examine force feeding and what it involves. Force feeding can mean literally forcing food into the cat's mouth, but more commonly means using appetite stimulants, feeding tubes, assisted feeding with strong flavored foods, or persistent attempts to feed a cat who is consistently refusing food. The goal is maintaining nutritional intake despite the cat's lack of interest. Appetite stimulant medications, including mirtazapine, are commonly prescribed for cats not eating. These medications can stimulate appetite temporarily in some cats. The question is whether stimulating appetite serves the cat's well-being or serves the owner's need to see the cat eating. Feeding tubes, including nasogastric tubes or esophagostomy tubes, provide direct nutrition, bypassing the mouth and throat. These tubes are invasive, must be maintained by the owner, must be kept clean, and represent a substantial intervention for a dying cat. The distress of force feeding is that most cats experiencing appetite loss do not want to be forced to eat. The cat who refuses food is communicating that eating is not what they want right now. Force feeding violates this communication and creates conflict and stress around eating. The physical consequences of force feeding a cat whose body is shutting down include that the digestive system may not process the food, creating constipation or diarrhea. The cat may feel nauseous or bloated from food their body cannot process. The cat may vomit from forced eating. The cat may become stressed and anxious around mealtimes. The burden on the cat is that feeding time becomes a source of stress rather than comfort. The cat knows that eating time means being handled, being forced to do something they do not want, possibly gagging or choking or becoming nauseous. This association makes the final days unpleasant rather than peaceful. The emotional burden on the owner is substantial because force feeding requires doing something unpleasant to your cat, requires overriding the cat's obvious refusal, requires experiencing the cat's resistance and distress. Many owners report that attempting to force feed their dying cat was more distressing than accepting the lack of eating would have been. The false hope is that maintaining nutritional intake will extend life or improve quality. Research does not support this. Forced nutrition in end-stage disease does not extend life meaningfully and often diminishes quality of remaining life through the stress and discomfort of forced eating. Now let's examine accepting natural appetite loss. Accepting appetite loss means stopping attempts to force or encourage eating, and instead focusing on what comfort and pleasure the cat can experience without food. It means accepting that not eating is part of normal dying and is not something that requires intervention. The freedom of accepting appetite loss is that mealtimes stop being a source of conflict. If the cat wants to eat, food is available. If the cat does not want to eat, that is accepted without judgment or attempts at forcing. The comfort focus shifts to what else the cat needs. If eating is not important, what is important to the cat's comfort in these final days? Soft, comfortable spaces. Being near loved ones or being left alone depending on the cat's preference. Gentle handling or no handling. Pain management. These become the focus instead of forcing nutrition. The observation of accepted appetite loss is often that the cat shows relief. No longer being forced to eat, the cat becomes calmer. The stress around meal times disappears. The cat seems more peaceful. The guilt that sometimes arises is that owners feel they are starving their cat by accepting appetite loss. This guilt is based on misunderstanding. The cat is not starving because of the owner's decision. The cat's body is shutting down and no longer requiring or wanting food. Accepting this is not causing harm. Forcing food against the body's signals causes harm. Let's address the distinction between appropriate nutritional support and inappropriate force feeding. Appropriate nutritional support may include offering favorite foods if the cat wants them, offering food that is easy to eat and digest if the cat shows interest, providing water and hydration support if the cat is willing, and using appetite stimulants in early stages of disease when there is reasonable possibility of recovery or meaningful life extension. Inappropriate force feeding includes forcing food into a cat who clearly does not want it, using aggressive feeding techniques, using feeding tubes merely to maintain nutrition without improving quality of life, and continuing forced feeding when the cat's condition is clearly terminal and no recovery is expected. The timing question is when to stop attempting to maintain nutrition. The answer is when the cat is clearly dying, when no recovery is expected, when forced nutrition causes distress, and when the cat consistently refuses all offered food over days or weeks. At that point, accepting appetite loss and focusing on comfort becomes appropriate. The last meal for many dying cats comes to have special significance. The owner remembers the last time the cat ate with interest. This memory is often bittersweet, but also can be a gentle way of marking the transition from living to dying. Let's address the emotional components of appetite loss that make this decision difficult. The food as love equation is deeply embedded in human culture. We feed people we love. We show care through food. When your cat refuses food, it feels like rejection of your care. This feeling is strong and must be acknowledged, but also must be recognized as projection. The cat is not rejecting your love. The cat is not rejecting food as a statement. The cat is simply not hungry. The control aspect is that feeding is often the one thing an owner feels they can control when their cat is dying. Other aspects of the disease cannot be controlled, but feeding can be controlled and attempted. Accepting that the cat will not eat is accepting loss of control that is already complete. The bargaining often occurs where owners think if the cat eats, the cat will recover, will survive longer, will be okay. The eating becomes symbolic of the possibility of recovery. Accepting appetite loss becomes accepting that recovery is not possible. The permission that owners need is permission to accept that their cat's refusal of food is not an emergency, is not a betrayal, is not a sign that more aggressive intervention is needed. Permission that accepting appetite loss is appropriate and kind, not giving up. The verdict appetite loss in end-stage disease is a normal and often beneficial part of dying, not a medical emergency to be prevented. Force-feeding dying cats typically diminishes quality of remaining life through stress and discomfort without extending life meaningfully. Accepting appetite loss and focusing instead on comfort and presence creates more peaceful final days for the cat and less guilt for the owner. When your cat stops eating, the first question should not be, how do I get them to eat? But rather, is this cat dying? And if so, what does comfort look like now? If your cat is early in illness and has lost appetite due to something treatable, nutritional support and appetite stimulants may be appropriate. But as terminal decline becomes clear, accepting appetite loss becomes the kind decision. Do not force-feed your dying cat to avoid the guilt of accepting death. The guilt will follow you regardless. What you can control is whether your cat's final days involve conflict and forced eating or involve peace and acceptance. The last meal your cat wants to eat will likely be their last meal. Make note of it. It is a gentle marker of transition. Do not make it the beginning of a battle to force more eating. If you are currently struggling with your cat's appetite loss, ask yourself whether you are attempting to maintain nutrition because it serves your cat's well-being or because it serves your need to feel like you are doing something. Be honest with yourself. Your cat will benefit more from your honest acceptance than from your desperate attempts at forced feeding. Accepting that your cat will not eat is one of the hardest acceptances of end-of-life care. But it is also often the moment when the cat becomes noticeably more peaceful, more comfortable, and more present. Sometimes letting go of control creates the peace you have been trying to force. Comparison 4. Litter box problems. Medical treatment versus behavioral versus acceptance. Litter box problems in senior and dying cats are among the most distressing issues for owners because they challenge the owner's ability to provide care, create conflict in the home, and are frequently misunderstood and mismanaged. A cat with kidney disease, arthritis, neurological decline, or cancer may begin eliminating outside the litter box not because of behavioral problems, but because of pain, physical inability, or loss of control over elimination. Yet owners often treat litter box problems as disciplinary issues, as behavioral problems requiring training correction, or as medical problems requiring aggressive treatment of potential urinary infections that may not exist. The contrast is between owners who pursue aggressive medical investigation and treatment of litter box problems, owners who address them as behavioral issues requiring environmental changes and training, and owners who recognize that in terminal disease, accepting litter box problems and managing the environment may be more appropriate than pursuing futile treatment. This comparison examines why litter box problems occur in end-stage disease, what medical, behavioral, and environmental approaches involve when each is appropriate, and how to distinguish between problems worth treating and problems that are better managed through acceptance and adaptation. Let's start with why litter box problems occur in senior and dying cats. Pain-driven elimination is the most common cause of litter box problems in senior cats. Arthritis pain makes it difficult or impossible to crouch in a litter box. Back leg pain makes the cat unable to assume the elimination posture. Spinal pain makes the act of elimination painful. Rather than experiencing pain to use the box, the cat eliminates wherever they are standing or lying. This is not a litter box problem. This is a pain problem. Kidney disease and urinary changes cause increased urination and loss of control over elimination. A cat with kidney disease may need to urinate more frequently than the cat can reach a litter box. The cat may lose some ability to hold urine. The elimination occurs not because the cat wants to eliminate outside the box, but because the body's physiology has changed. Neurological decline, including dementia, stroke, spinal cord problems, or other neurological disease, causes loss of normal elimination control. The cat may not recognize the need to use the box. The cat may not remember where the box is. The cat may not be able to coordinate the physical act of elimination correctly. These are neurological problems, not behavioral or training problems. Gastrointestinal issues, including diarrhea from kidney disease, cancer, or other illness, cause urgency and inability to reach the box in time. The cat is not choosing to eliminate outside the box. The cat's body is not giving them the opportunity to reach the box. Loss of proprioception or sensory decline means the cat may not feel themselves eliminating or may not feel the need to use the box. The cat seems surprised by accidents. The cat has lost some of the normal sensation that signals the need for elimination. Environmental factors including box placement that is difficult to access, box type that is painful to enter, litter type that is uncomfortable, or boxes that have become associated with pain or stress all contribute to litter box problems. The critical distinction is that most litter box problems in senior cats have a medical or physical cause, not a behavioral cause. Yet owners, and sometimes veterinarians, treat them as behavioral issues, creating guilt and shame in owners and ineffective management strategies. Now let's examine the medical treatment approach to litter box problems. Medical investigation of litter box problems includes urinalysis to check for infection, urine culture to identify bacteria, blood work to assess kidney function and other organ systems, imaging to rule out blockages or other physical problems, and sometimes additional diagnostics depending on findings. Antibiotic treatment is commonly prescribed for urinary tract infections, which are common in senior cats. However, not all inappropriate elimination indicates infection. Many cats have bacteria in their urine without clinical infection requiring treatment. Giving antibiotics for asymptomatic bacteriuria does not improve elimination problems and contributes to antibiotic resistance. Dietary management, including prescription diets designed for kidney disease, urinary issues, or digestive problems, can sometimes help if the underlying problem is treatable. For a cat with early kidney disease, a renal diet may help manage the disease. For a cat with terminal kidney failure, dietary changes are unlikely to help and may deprive the cat of preferred foods. Medication, including diuretics, pain medications, or other medications addressing underlying causes, can sometimes improve litter box behavior if the problem is pain-driven or medically addressable. The investigation burden for dying cats is substantial. Litter box problems often lead to extensive veterinary investigation, multiple visits, stress to the cat from handling and diagnostics, and often nothing found that can meaningfully be treated. The cat experiences stress and disruption without benefit. The false hope is that identifying a urinary tract infection and treating it will solve the litter box problem. Many cats have concurrent problems, meaning the infection was only one factor. The cat may have pain, arthritis, loss of control, and other factors that persist even after infection is treated. Now let's examine the behavioral approach to litter box problems, environmental modification, including increasing litter boxes from the standard one box per cat to multiple boxes at different locations, changing box type from enclosed to open if the cat shows preference, changing litter type or relocating boxes to be more accessible sometimes addresses litter box problems. Accessibility improvement, including reducing the height of boxes, providing ramps or steps for cats with mobility issues, or placing boxes on each level of the home, can sometimes help cats access boxes when pain or mobility issues interfere. Box cleaning, increasing the frequency of cleaning, changing from clumping to non-clumping litter if the cat has shown preference, or other environmental adjustments may help. Stress reduction, addressing any environmental stressors that might contribute to inappropriate elimination, can sometimes help. Though in terminal disease, the stress is often internal and cannot be fixed through environmental changes. Training and management using enzymatic cleaners to remove scent from accident sites, confining the cat temporarily to areas with litter boxes, or other management strategies can sometimes help. But in end-stage disease, these strategies are often ineffective because the problem is medical, not behavioral. The limitation of behavioral approaches in terminal disease is that they frequently cannot address the underlying medical problem. A cat with severe arthritis pain does not use the litter box better because it is relocated. A cat with kidney disease does not have fewer accidents because there are more boxes. The behavioral approach works when the problem is behavioral but fails when the problem is medical. Now let's examine the acceptance approach for terminal disease. Accepting litter box problems in terminal disease means recognizing that the cat's body is failing, and that litter box problems are a symptom of that failure, not a problem to be solved. The focus shifts from preventing accidents to managing the home environment. Environmental protection, including using waterproof pads or puppy pads in the cat's favorite resting areas, protecting furniture with waterproof covers, cleaning with enzymatic cleaners to neutralize scent, and accepting that the home will need more frequent cleaning all become the practical focus. The cat's comfort over the owner's frustration becomes the priority. If the cat is comfortable resting on soft blankets where accidents might occur, this is more important than protecting the furniture. The blankets can be washed. The cat's comfort matters more. Reduced intervention means stopping investigation if it will not change treatment, stopping medications that are not helping, and stopping stress-inducing veterinary visits that do not provide medical benefit. The release for many owners comes when they stop trying to solve the unsolvable and instead focus on managing what cannot be solved. The shame and frustration about litter box accidents often decrease dramatically when the owner stops seeing them as a problem to be fixed and starts seeing them as a symptom to be managed. Let's address the distinction between problems worth investigating and problems that are better managed through acceptance. Worth investigating when the cat is young to middle-aged and the problem is acute and new. The cat's condition is not terminal or the problem might be treatable. The cat shows signs of pain or distress that treatment might address. There is reasonable possibility that treatment will improve the problem. Better managed through acceptance when the cat is clearly terminal or in end-stage disease. The investigation will not change the treatment plan. Previous investigations have identified problems that cannot be treated. The cat is showing multiple signs of body systems failing. The cat's quality of life is already compromised. An investigation would add stress. The owner guilt around litter box problems is profound because owners feel they should be able to solve it, should be able to keep their home clean, should be able to prevent the cat from having accidents. The guilt is often worse than the actual problem. Releasing the guilt requires accepting that some problems cannot be solved through owner effort because they are caused by the cat's body failing, not by the owner's failure to manage the cat properly. The safety consideration is that while accepting some litter box problems, the home must still be safe. If the cat is eliminating on things that the cat is sleeping on, the cat is resting in soiled areas, which creates health risks. The balance is between accepting that problems cannot be solved and maintaining enough hygiene that the cat is not at risk from resting in contaminated areas. The verdict litter box problems in senior cats are usually caused by medical or physical issues, not behavioral problems, but are frequently mismanaged as behavioral issues. Medical investigation can be appropriate when the problem is potentially treatable, but investigation for its own sake in terminal disease often creates stress without benefit. Environmental modification can help when the cat has accessibility issues, but cannot solve problems caused by loss of elimination control or pain. Accepting litter box problems in terminal disease and managing the environment is often more humane and more practical than pursuing futile treatment or investigation. The key is recognizing whether the problem is potentially solvable or whether it is simply a symptom of body system failure that must be accepted and managed. If your senior cat has litter box problems, work with your veterinarian to determine the cause. If pain is a factor, pain management may help. If kidney disease is causing the problem, accepting some accidents while managing the environment may be more appropriate than intensive investigation and treatment. Do not feel shame about litter box problems or about accepting that your home may need extra cleaning. Your cat is not behaving badly. Your cat's body is failing. The litter box problem is a symptom, not a character flaw in your cat or a failure on your part. If investigation has been done, problems identified are not treatable. and your cat is otherwise terminal, give yourself permission to stop investigating and start managing. Clean up accidents with enzymatic cleaners. Protect your furniture and flooring. Focus on your cat's comfort. Let go of the shame. Many owners report that accepting litter box problems and shifting from trying to solve them to managing them is the moment when their relationship with their dying cat shifts from fighting to accepting. The acceptance creates peace that fighting never achieved. Comparison 5. Mobility loss, environment. Modification versus activity restriction. As senior cats experience arthritis, neurological decline, spinal problems, or other conditions affecting movement, they face increasing difficulty navigating the environment that was designed for younger, more mobile cats. Owners respond to mobility loss with contrasting approaches. Some owners modify the environment extensively, providing ramps, low-entry furniture, accessible water and food, and creating pathways that accommodate the cat's reduced mobility so the cat can continue engaging with their environment despite physical limitations. Other owners restrict the cat's activity and access, confining the cat to smaller areas or limiting their movement, reasoning that restriction prevents falls or injuries. The contrast is between owners who invest in environment modification to preserve the cat's independence and quality of life, and owners who restrict the cat's world in an attempt to prevent injury or provide simplicity. This comparison examines what mobility loss means, what environmental modification actually accomplishes, what restriction costs, how to balance independence with safety, and how to recognize when modification is preserving quality of life versus when restriction is appropriate, because the cat genuinely cannot safely navigate the home. Let's start with why mobility loss occurs and what it means for the cat's experience. Arthritis is the most common cause of mobility loss in senior cats. The joints deteriorate, movement becomes painful, and cats begin to move less or move with difficulty. The pain decreases when the cat is at rest. Cats with arthritis prefer to rest more because movement hurts. They show reduced jumping, reduced climbing, reduced exploration, and reduced activity. Neurological decline, including spinal cord problems, nerve damage, or neurological disease, affects the cat's ability to coordinate movement or may cause weakness, paralysis of rear legs, or loss of balance. The cat may have difficulty walking, may drag rear legs, may have loss of coordination, may fall more frequently. Pain from other sources, including cancer pain, organ pain, or other conditions, may make movement painful. The cat restricts movement to minimize pain. This is protective behavior, but also means isolation and decreased quality of life. Sensory loss, including vision loss or hearing loss, affect the cat's ability to navigate safely. A blind cat must navigate by feel and memory. A deaf cat loses auditory cues that help with spatial awareness. The behavioral response to mobility loss is that cats naturally restrict their own activity. A cat with painful joints will not jump if jumping causes pain. The cat will find paths of less resistance. The cat will spend more time at rest. This self-restriction is appropriate and protects the cat from injury. The owner's perception is often that mobility loss means the cat's quality of life is unacceptably compromised. But mobility loss and quality of life are not identical. A cat with mobility problems but adequate pain management, adequate access to resources, and adequate social interaction can still have acceptable quality of life. A cat whose world has been restricted and who is isolated may have worse quality of life than their physical limitations alone would require. Now let's examine environmental modification and what it involves. Ramps and steps provide accessible pathways to elevated spaces that the cat cannot jump to. A ramp at a gradual incline allows the cat to walk to a favorite resting spot without requiring a jump. Steps to furniture allow graduated ascent instead of one large jump. Lowered furniture, including lowering favorite perches, providing low-entry cat beds, or choosing furniture at lower heights, allows the cat to access resting places without high jumps. Ground-level access to resources, including food, water, and litter boxes that are easily accessible, prevents the need for the cat to navigate stairs or jump up to reach necessities. Multiple resource locations, including placing litter boxes, water, and food at different levels and locations, ensures the cat can access what they need from wherever they are in the home. Flooring modification, including providing rugs or non-slip surfaces, helps cats with balance or coordination problems maintain traction and reduces falls. Stair management, including gates preventing access to stairs the cat cannot safely navigate, or providing ramps alongside stairs, helps prevent falls. Temperature management, because arthritic cats are very temperature sensitive and do better in warm environments. Providing heated beds or access to warm areas improves comfort. Pain management, including pain medication, supplements supporting joint health, or other pain management supports mobility by reducing pain-driven movement restriction. The investment in environmental modification can be substantial in terms of money and space, but the outcome is often that the cat continues to have independence and ability to engage with their environment. The behavioral outcome of good environmental modification is that cats often continue higher activity and engagement than cats whose mobility is restricted. A cat with ramps and accessible spaces will climb, will explore, will have higher quality of life than a cat with the same physical limitations but no environmental support. The dignity preservation of modification is that the cat retains ability to make choices about their movement and their location. The cat can choose to climb or rest. The cat retains independence even with mobility limitations. Now let's examine activity restriction and what it involves. Confinement to smaller spaces, like a single room, prevents the cat from navigating stairs or having access to too many levels. The cat is contained in a space where essentials are easily accessible. Activity limiting, including preventing jumping, preventing climbing, preventing exploration in some areas, limits the cat's activity based on the owner's assessment of what is safe. Barrier placement using gates or closed doors prevents access to areas the owner believes are too risky, like stairs or upper-level spaces. Simplification of the cat's territory means reducing the complexity of spaces and reducing the cat's world to what can be safely managed. The safety rationale is that restriction prevents falls, prevents the cat from overexerting themselves, prevents injury from attempting movement that the cat cannot safely perform. The practical reality of restriction is that cats who cannot or will not accept restriction become stressed. A cat who wants to climb stairs but cannot access them due to gates becomes frustrated. A cat confined to a small space loses enrichment and engagement. The behavioral consequence of excessive restriction is often increased stress, increased anxiety, increased behavioral problems, including aggression or inappropriate elimination. The cat is frustrated by their restrictions. The psychological cost is that some cats show acceptance of restriction and some show clear distress. A cat accepted in a smaller space with adequate resources may be content. A cat struggling against restrictions becomes worse off than they would be with environmental modification allowing more freedom. The passive outcome of restriction is that cats become increasingly sedentary. With no access to levels, no access to spaces that encourage exploration, the cat rests more and moves less. This can actually accelerate functional decline because lack of movement contributes to further loss of strength and mobility. Let's examine the balance between modification and restriction. Appropriate modification is when the cat can physically perform basic movements and when modification allows the cat to continue those movements safely. A cat with arthritis can walk and can crouch to use a litter box, but jumping is painful. Providing ramps allows continued access to favorite spaces while reducing painful jumping. Appropriate restriction is when the cat physically cannot safely perform certain movements, even with environmental support. A cat with severe rear leg paralysis cannot navigate stairs safely, even with ramps. A cat with severe balance problems cannot safely access heights. In these cases, restriction prevents injury from attempts at movement the cat cannot physically perform. The dignity consideration is critical. There is a difference between restricting movement the cat cannot physically perform and restricting movement the cat can perform, but the owner finds inconvenient or risky. The first is protection. The second is control. The pain management connection is that many mobility restrictions that seem necessary are actually pain-driven. A cat with severe arthritis pain may show improvement in mobility with adequate pain medication that allows the cat to move more freely. Environmental modification combined with pain management is often more effective than restriction alone. The assessment challenge is that owners often restrict activity before attempting modification and pain management. The owner sees the cat moving slowly and assumes the cat cannot move more. The cat may actually be able to move more with support and pain management. The trial approach involves attempting environmental modification and pain management first before restricting activity. If the cat improves and shows increased activity and engagement, the modification was sufficient. If the cat continues to be unable to move safely despite support, then restriction becomes appropriate. The verdict mobility loss in senior cats is common and manageable through combination of environmental modification and pain management rather than through activity restriction. Environmental modification preserves the cat's independence, engagement, and quality of life, even with mobility limitations. Activity restriction may be necessary for cats with severe physical limitations, but is often overused before adequately attempting modification and pain management. The key is assessing what the cat can physically do with support versus what the cat cannot do, even with support, and designing the environment accordingly. If your senior cat shows signs of mobility loss, the first step should be environmental modification and pain assessment. Provide ramps, lower platforms, accessible resources. Address any pain-limiting mobility. Give the cat the environmental support to continue functioning before restricting activity. Do not confine your aging cat to a small space based on assumption that the cat cannot navigate the home safely. Most cats with mobility problems can navigate with appropriate support and pain management. A cat given appropriate environmental modification often surprises owners with continued ability to move, explore, and engage despite physical decline. The modification preserves not just quality of life, but the cat's identity as an active being, rather than reducing the cat to a passive recipient of care. If after good faith, attempts at modification and pain management, your cat genuinely cannot safely navigate or is injuring themselves attempting movement, then restriction becomes appropriate. But this should be the last resort, not the first response to mobility loss. The distinction between control and protection is important. Are you restricting activity to protect your cat or to make your life easier? If the answer is to make your life easier, reconsider. Your cat's engagement and independence during their final years is more important than your convenience. A cat spending their final years in a small, restricted space loses a significant part of what makes life worth living. A cat given environmental support to continue engaging with their environment retains quality of life that restriction cannot provide. Invest in environmental modification for your senior cat. The ramps and steps are temporary. The preserved quality of life is lasting. The memory of your cat continuing to engage with their world despite physical decline is the legacy you want, not the memory of your cat confined and restricted. Comparison 6. Blindness/deafness. Full adaptation support versus limiting independence. When senior cats lose vision or hearing, owners frequently interpret the sensory loss as a catastrophic decline in quality of life that justifies restricting the cat's independence and confining the cat to smaller spaces. Yet cats adapt to blindness and deafness far more effectively than humans expect, maintaining active engagement with their environment despite sensory loss when owners provide appropriate support and maintain confidence in the cat's ability to function. The contrast is between owners who assume sensory loss means quality of life is unacceptable and restrict the cat's world accordingly, and owners who provide environmental support and maintain normal expectations while the cat adapts to the sensory changes. This comparison examines how cats experience sensory loss, how adaptation actually occurs, what support enables cats to continue active engagement despite blindness or deafness, what limiting independence costs, and how to distinguish between necessary protection and unnecessary restriction. Let's start with why sensory loss occurs and how cats perceive these changes. Blindness in senior cats commonly results from cataracts, which cloud the lens, from hyperthyroidism-related eye problems, from glaucoma, from retinal atrophy, or from other age-related eye conditions. The blindness develops gradually in many cats, allowing adaptation over time as vision progressively decreases. Deafness in senior cats results from age-related hearing loss, from long-term effects of ear infections, or from genetic predisposition to deafness in white cats. Like blindness, hearing loss often develops gradually over time. The cat's non-visual senses are substantially more acute than human senses. Cats navigate through hearing, through smell, through touch, through whiskers that detect air movement and objects, and through proprioception that tells the cat their body position. Losing one sense does not eliminate the cat's ability to navigate because other senses compensate. The adaptation mechanism is that cats literally remap their understanding of their environment. A blind cat still knows their home because they have learned the layout through memory, through smell, through feel of different flooring and obstacles, through the sounds of different rooms. The cat's map of home does not depend on vision. The human tendency is to assume that sight and hearing are as essential to cats as they are to humans. Owners catastrophize sensory loss and assume the cat's experience is unacceptably limited. But cats experience the world very differently from humans and compensate for sensory loss far more effectively than human experience would predict. The adjustment period varies, but many cats show substantial adaptation within weeks to months of the onset of sensory loss. The cat learns the home layout, learns where obstacles are, learns how to navigate safely using the senses they still have. The behavioral observation is that many blind and deaf cats show no obvious behavioral changes to an observer unfamiliar with them. The cat moves through the home, uses litter boxes, eats, sleeps, and engages with family members much as they did before sensory loss. The sensory loss is less obvious than owners expect. Now let's examine the limiting independence approach and what it involves. Confinement of cats with sensory loss to smaller spaces, like a single room or bathroom, based on the assumption that the cat cannot safely navigate a larger home is a common response to blindness or deafness. Activity restrictions, including preventing the cat from using stairs, preventing the cat from accessing multiple levels, or preventing outdoor access, come from concern about safety. Barrier placement using gates or closed doors to prevent the cat from areas the owner believes are too risky based on the sensory loss. Environmental simplification, reducing the complexity of the cat's territory, removing furniture, reducing the number of obstacles the cat must navigate. The safety rationale is that sensory loss creates risk of falls, collision with obstacles, getting lost, or injury. Restriction prevents these risks. The practical reality is that cats confined based on sensory loss often show depression, reduced activity, reduced engagement with family, and sometimes behavioral problems, including aggression or excessive vocalization. The cat is frustrated by restrictions. The assumption error is that owners restrict based on assumption about what the cat can do, not on observation of what the cat actually does. Many cats restricted based on blindness or deafness actually navigate more safely than the owner assumed they would. The quality of life cost of unnecessary restriction is substantial. A cat spending their final years in a single room loses environmental engagement, loses the ability to make choices about their location and activity, becomes isolated and depressed despite having sensory loss that may not actually prevent safe navigation. The behavioral outcome is often that cats who accept their restriction become passive and withdrawn. The sensory loss alone might not have significantly impacted quality of life, but the restriction imposed because of the sensory loss creates the very quality of life problem the owner was trying to prevent. Now let's examine full adaptation support and what it involves. Environmental stability where the cat's home remains consistent and obstacles remain in predictable locations allows the cat to learn and navigate using memory and other senses. Constantly moving furniture prevents the cat from learning and navigating. Scent marking that identifies different areas through consistent scent allows the cat to navigate by smell. Keeping distinct areas with distinct scents helps the cat know where they are. Tactile markers, including placing different textures in different areas, can help cats with sensory loss navigate. A different rug texture signals a different room. Sound sources that mark locations can help deaf cats navigate. A water fountain in the kitchen, a specific location of pet activity noise, helps the cat navigate through sound that is produced by the household rather than by hearing general environmental sounds. Vocal cues for deaf cats, including hand signals, vibration signals, or visual signals, can supplement lost hearing. Many deaf cats respond to vibration or to visual cues despite not hearing. Night lights or consistent lighting helps cats with vision loss navigate. Darkness increases disorientation for blind cats, but consistent lighting allows some navigation even with impaired vision. Obstacle removal of unnecessary obstacles creates safer pathways even as the cat's other senses compensate for sensory loss. Litter box accessibility, ensuring litter boxes are in easily accessible locations and remain in consistent locations, helps cats with sensory loss maintain appropriate elimination. Feeding station consistency with consistent location and consistent routine helps the cat find food reliably despite sensory loss. Normal expectations, where the owner maintains confidence that the cat can navigate, where the owner does not hover anxiously or restrict activity based on worry, allows the cat to develop and maintain independence. The emotional component is substantial because owners with confidence in their cat's ability to adapt allow the cat to continue normal activity, which builds the cat's confidence and results in successful adaptation. Owners with low expectations of the cat's ability restrict activity, which actually prevents the adaptation that would occur. Let's address what quality of life actually looks like for a blind or deaf cat. Active engagement continues in most blind and deaf cats if they are given the opportunity. A blind cat will still play with toys. A deaf cat will still interact with family. Neither sensory loss alone typically creates devastating quality of life decline. Pain or other medical problems are often what actually drive quality of life decline in cats with sensory loss. A blind cat with arthritis pain has worse quality of life than blindness alone creates. But the assumption that sensory loss is catastrophic often prevents addressing the actual medical problems that are damaging quality of life. Social engagement continues in most blind and deaf cats. The cat may engage differently, may navigate differently, but the cat can still bond with family members, can still enjoy human company, can still show affection. Sensory appreciation changes, but does not stop. A blind cat cannot see birds but can hear them and smell the outdoor air. A deaf cat cannot hear family voices but can see movement and feel vibration. The cat still appreciates elements of their world. Independence is maintained by most cats with sensory loss unless restricted by owners who assume the cat cannot function independently. A cat given the opportunity to navigate independently usually does so successfully. The research on cats with sensory loss shows that cats adapt remarkably well and maintain good quality of life despite blindness or deafness. The quality of life problems are more often caused by owner-imposed restrictions than by the sensory loss itself. Let's examine when limiting independence becomes appropriate. Necessary protection is appropriate when the cat has additional problems beyond sensory loss that create genuine safety risks. A blind cat with severe arthritis that prevents safe movement may need restriction. A deaf cat with cognitive decline that causes confusion may need a smaller space. But the restriction should be based on the combination of problems, not on sensory loss alone. Trial period of normal activity with sensory loss allows observation of whether the cat can safely navigate. Many owners are surprised by how well their cat adapts. If after a reasonable trial period the cat clearly cannot navigate safely despite support, then restriction may become appropriate. Observation-based decision-making means watching what the cat actually does, not assuming what the cat can do. If the cat navigates safely despite sensory loss, restriction is not needed. If the cat has genuine difficulty despite environmental support, then restriction may be warranted. The verdict: cats adapt to blindness and deafness far more effectively than owners assume, and most cats with sensory loss maintain acceptable quality of life with appropriate environmental support. Limiting independence based on assumption about sensory loss often creates more quality of life problems than the sensory loss itself creates. Environmental support, including consistent layout, scent marking, accessible resources, and normal expectations, allows most cats to maintain independence and engagement despite sensory loss. The key is distinguishing between restricting based on the cat's actual demonstrated inability to function safely versus restricting based on owner anxiety about what the cat might not be able to do. If your cat is losing vision or hearing, do not immediately restrict activity or confine to smaller spaces. Instead, provide environmental support and observe what the cat actually does. Most cats surprise owners with their successful adaptation. Maintain consistent home layout so the cat can learn and navigate using memory and other senses. Do not constantly rearrange furniture based on worry about obstacles. Consistency allows adaptation. Understand that your cat's quality of life depends far more on continuing to engage with their environment than on maintaining the specific senses they have lost. Preserving engagement is more important than preventing any possible risk from sensory loss. Many owners report that their greatest regret regarding sensory loss in their cats was not the sensory loss itself, but their own overreaction to it. They restricted their cats unnecessarily and later realized their cats would have done fine with normal activity. Give your blind or deaf cat the opportunity to show you how well they adapt. Most cats will amaze you. Your job is to provide supportive environment, maintain confidence in your cat's ability, and resist the urge to restrict based on worry rather than on actual demonstrated need. A blind or deaf cat continuing to engage with their home, continuing to interact with family, continuing to make choices about their activity and location has quality of life that is not devastated by sensory loss. Unnecessary restriction of that cat creates the quality of life problem you are trying to prevent. Comparison 7. Multi-cat with one sick. Isolation versus continued interaction. When one cat in a multi-cat household becomes seriously ill or begins dying, owners face a decision about whether to isolate the sick cat from other household cats to prevent stress, prevent spread of potential infection, or provide peace for the sick cat, or whether to allow continued interaction and companionship between the cats. Isolation seems protective, removing the stress of other cats, preventing transmission of possible disease, providing the sick cat quiet space for recovery. Yet many cats in multi-cat households have strong social bonds, and isolation from bonded companions creates stress and loneliness that may be more damaging than any benefit from separation. The contrast is between owners who separate sick cats based on protective assumptions and owners who recognize the value of continued companionship and allow cats to maintain their relationships despite one cat's illness. This comparison examines why isolation happens, what isolation accomplishes, what continued interaction looks like, how to assess whether isolation is necessary or whether it is unnecessary separation, and how to recognize when your cats want to be together despite one being ill. Let's start with why owners isolate sick cats and what the assumptions are. The protection instinct is that owners see their cat's illness or decline and want to provide peace, quiet, and separation from other cats who might stress the sick cat. The impulse comes from love, but is often based on incorrect assumptions about what the sick cat needs. Infection control is a common reason for isolation. If the sick cat has a contagious illness, the owner isolates to prevent transmission to other cats. This is appropriate when genuine infection risk exists, but owners often isolate based on assumption of infection risk without knowing whether actual risk exists. Stress prevention is another common reason. The owner assumes that other cats will stress the sick cat, that the sick cat needs quiet isolation to rest and recover. The owner believes separation is protective. The dying cat assumption is that when a cat is dying, they need to be left alone, need isolation, need separation from the family and other cats. This assumption is frequently incorrect. Practical simplification is that isolation simplifies the owner's management. Monitoring one cat in one room is easier than monitoring cats in multiple spaces. Medication can be given in isolation. The sick cat cannot hide or avoid monitoring. The isolation often serves the owner's need for simplification more than the cat's medical need. The guilt factor is that seeing other cats potentially stress their sick cat makes owners feel guilty. Separating the cats makes the owner feel they are doing something protective. The misunderstanding is that rest and recovery require isolation. Most cats rest better with companionship of bonded companions than in enforced isolation where they are stressed and lonely. Now let's examine the isolation approach and what it involves. Physical separation means keeping the sick cat in a separate room with resources, litter box, food, water, resting places, and preventing contact with other household cats. Duration of isolation may be temporary during acute illness or may extend through the entire dying process, depending on the owner's assessment. Monitoring becomes easier during isolation because the owner can observe the cat constantly and can control what the cat is doing. Infection prevention through isolation physically prevents transmission of any illness to other cats, though the risk may be overstated. Peace provision in theory allows the sick cat to rest undisturbed, though in practice the cat may be stressed by isolation rather than at peace. Reduced complexity for the owner means not having to manage multiple cats with different needs. The cat's experience of isolation varies. Some cats accept isolation. Others show significant stress, hiding, vocalization, reduced eating, behavioral problems from enforced separation. The isolation often creates stress rather than reducing it. The relationship disruption is that cats with close bonds who are separated often show distress. Bonded cats who groom each other, sleep near each other, or interact regularly experience stress from separation. The emotional impact on the owner is that separating a dying cat often creates guilt and sadness. Owners report feeling like they are abandoning their cat in isolation. The emotional burden on the owner increases rather than decreases. The outcome in many isolated cats is that the cat's final days are spent in enforced loneliness, where the cat could have spent that time with bonded companions. The isolation often creates more suffering than the cat's actual medical condition alone would create. Now let's examine continued interaction and what it looks like. Maintained access to other household cats means the sick cat is not physically separated and can interact with other cats as they choose to. Natural distance between cats develops because the sick cat may choose to rest more and interact less without being forced into isolation. But the option for interaction remains. Social bonding continues and may provide comfort to the sick cat. A cat near the end of life may find comfort in the presence of bonded companions. Reduce stress from maintained companionship as the sick cat is not stressed by enforced isolation. Choice for the cats about whether to interact or maintain distance. The cats can self-regulate their interaction rather than having the owner impose separation. Normal household where the sick cat remains part of the family group rather than being separated and excluded. Observation of how the cats actually interact during one cat's illness. Many cats naturally decrease interaction with a sick or dying cat and maintain distance without being forced into isolation. Other cats provide comfort and companionship. The possibility that other cats grieve when one cat is dying. Cats separated from a dying cat may show behavioral changes, including searching for the missing cat, increased vocalization, or stress. Preventing isolation may allow the cats to process change together. The medical reality is that continued interaction rarely harms recovery and often supports well-being through reduced stress. Let's address the distinction between appropriate isolation and unnecessary separation. Appropriate isolation is when the sick cat has a genuinely contagious disease requiring isolation for public health or other cats' health. The sick cat is showing aggression or stress toward other cats. When together, the sick cat is unable to access resources because other cats are preventing access. The sick cat is clearly stressed by other cats' presence and shows behavioral improvement when separated. Medical procedures require isolation temporarily. Unnecessary isolation is when isolation is assumed to be protective without observation of actual stress or problems from continued contact. The cats are bonded, and isolation causes obvious stress. No genuine infection risk exists. The sick cat chooses to interact with other cats when given the choice. The isolation serves the owner's convenience more than the cat's welfare. The observation approach involves monitoring what actually happens when the cats are together. Many owners are surprised to find that their cats regulate interaction appropriately. The sick cat rests and maintains distance when ill, and other cats allow this without conflict. The cats do not interact intensely, but the companionship of presence continues. The trial approach involves initially isolating if the owner feels isolation is needed, then gradually allowing supervised interaction to see what actually happens. Many owners find they can reduce isolation or eliminate it entirely because the cats actually do well together. The cat's preference in many multi-cat households is to remain with bonded companions even when one cat is ill. Cats will rest near each other without intensive interaction. The companionship is valued. The grief consideration is that cats in multi-cat households may have stronger attachment bonds than owners realize. Separating cats before one dies may prevent the other cat from processing the death. Some behaviorists suggest that allowing cats to remain together and potentially to see death occur may help the surviving cat process the loss. The emotional honoring of the relationship between cats includes allowing them to remain connected even when one is dying. The relationship has value and meaning. Isolation disrespects that bond. Let's address specific scenarios. Contagious illness, including upper respiratory infections, feline leukemia, or other communicable diseases, may genuinely require isolation. In this case, isolation is appropriate and necessary regardless of stress it may cause. Non-communicable illness, including cancer, organ failure, or other conditions that are not contagious, often do not require isolation. Continued interaction is safe and may be beneficial. Behavioral isolation, where the sick cat is aggressive or where other cats are aggressive toward the sick cat, may require temporary separation. But this is behavioral management, not protective isolation. The senior cat exception, where the sick cat's behavior changes due to cognitive decline or other neurological issues, may create conflict with other cats. Management of behavioral changes may be necessary while maintaining as much interaction as the cats can handle. The verdict. Isolating sick cats is often done for protective reasons, but frequently creates more stress and suffering than the isolation prevents. Continued interaction between cats, including bonded cats where one is dying, often supports well-being through reduced isolation stress and maintained companionship. The distinction between appropriate isolation for genuine medical reasons and unnecessary isolation based on protective assumptions is critical. Most cats with non-communicable illness benefit from continued interaction with bonded companions rather than isolation. If your cat is ill or dying and you have other cats, do not automatically isolate. Observe what actually happens when the cats are together. Most cats regulate their own interaction appropriately. The sick cat rests and maintains distance naturally. Other cats allow this without conflict. Only isolate if you observe actual problems from continued contact, genuine aggression, actual behavioral stress in either cat, or documented infection risk. Do not isolate based on assumption of problems that do not appear when you actually observe the cats together. Understand that isolation in the final days of a cat's life is often isolation in loneliness. Give your cat the option of companionship even if your cat chooses to rest alone much of the time. The presence of bonded companions is often comfort, even if active interaction decreases. If your cats are bonded and one is dying, allowing them to remain together honors their relationship and may support the grieving process for the surviving cat. Separation prevents that honoring and that processing. Many owners report that the moment they stopped isolating their sick cats and allowed interaction, both the sick cat and the surviving cat seemed more content. The unnecessary separation had created more problems than the illness itself created. Do not isolate your dying cat based on assumption of what would help. Observe what actually helps. In most cases, continued companionship with bonded cats provides more comfort than enforced isolation. Comparison 8. Home end-of-life care versus clinic/hospital care. As a cat's death approaches, owners face a decision about where the cat should spend their final days and where death should occur. Some cats spend their final days or weeks at home with family, in familiar surroundings, with comfort and closeness that only a home can provide, potentially dying peacefully at home or being brought to a clinic for euthanasia when the time comes. Other cats are admitted to veterinary hospitals or clinics where medical monitoring is available 24/7, where interventions can be provided immediately if needed, where professional staff manages care and comfort. The contrast is between the comfort and emotional support of home care and the medical readiness of professional facilities. This comparison examines what home care involves, what professional care provides, what the actual costs and benefits are of each, how to prepare for home care if that is the chosen path, and how to make a decision that aligns with your cat's needs and your family's capacity. Let's start with home end-of-life care and what it involves. Home care means the cat spends final days or weeks at home, with family, in familiar surroundings, with routine maintained as much as possible, with family present and involved in the cat's comfort care. Comfort prioritization is the primary focus of home care. The cat's comfort supersedes medical optimization. Pain management, positioning for comfort, warmth, familiar spaces, and presence of loved ones are the priorities. Family involvement means the family provides direct care, including pain medication administration, comfort management, hygiene if needed, and emotional support. The family is the primary caregiver. Familiar environment that the cat has lived in for years or decades provides psychological comfort. The cat knows the spaces, knows the sounds, knows the smell. The home is safe and familiar in ways that a hospital never is. Flexibility in care means the family can adjust comfort measures, can provide food if the cat wants it, can move the cat to different comfortable spaces, can let the cat's rhythm guide the day rather than hospital schedules. Monitoring must be done by the family who may or may not be experienced at recognizing changes in the cat's condition. The family must know what to watch for and when to call the veterinarian. After-hours availability means the family must have access to veterinary care if needed, and if the cat deteriorates unexpectedly. The family must know whom to call and must be prepared for emergencies. The responsibility burden is substantial. The family must manage medications, pain assessment, comfort care, cleanliness, food and water if the cat is eating, litter box management, and emotional presence, all while the family may be grieving and emotionally exhausted. The preparation requirement is that home care requires advanced planning. The family should discuss with their veterinarian what to expect, what signs to watch for, how to recognize pain or suffering, when to consider euthanasia, and how to access emergency care. The emotional support of dying at home with family present is profound. Many cats who die at home in the company of loved ones appear peaceful. Many families report that the experience, though heartbreaking, feels appropriate and meaningful in ways that hospital death does not. The cost of home care is typically lower than hospital care unless significant veterinary visits are needed. The primary cost is the owner's time and emotional labor. The loss of the home space is a consideration. Some families find that after their cat's death, the home space where the cat died becomes sad, and they struggle with being in that space. Others find comfort in the memories in that familiar place. Now let's examine professional facility care and what it involves. Hospitalization means the cat is admitted to a veterinary facility where professional staff provides 24/7 monitoring and care. The cat is in an unfamiliar environment with unfamiliar people and unfamiliar routines. Medical monitoring is continuous. Vital signs are monitored. Changes in condition are noted immediately. Interventions can be provided rapidly if the cat's condition changes. Professional pain management is overseen by veterinarians with expertise in pain assessment and management. Pain medications can be adjusted quickly if needed. Medication administration by trained staff ensures medications are given correctly and on schedule. The family does not bear the responsibility of medication management. After-hours care is built in. If the cat deteriorates at night or during the weekend, immediate veterinary care is available. Potential for intervention is available if the owner wants to attempt treatment. If the cat stops eating, intravenous fluids can be provided. If the cat's condition changes suddenly, medical responses are immediately possible. Distress from unfamiliar environment is a significant problem for many cats. The cat is confused by strange surroundings, is handled by unfamiliar people, does not have access to family for comfort, and experiences stress from the hospitalization itself. Separation from family means the cat faces dying alone or among strangers rather than with loved ones. Many cats show significant distress from this separation. Visiting limitations may mean the family can visit only at certain hours, cannot stay overnight, cannot provide comfort to the cat except during visiting times. The cat spends much of their final days without family presence. Cost of hospitalization is substantial. Daily hospitalization fees, monitoring fees, medication fees, and interventions all accumulate rapidly. Week-long hospitalization can cost thousands of dollars. The impersonal environment of a hospital is designed for medical care and safety, but is not designed for comfort or emotional support. The cat dies in a hospital setting rather than in a home with family. The benefit for acute crises is that hospitalization is extremely valuable when the cat faces acute medical crises, where immediate intervention can save life or address critical problems. But for end-of-life care, where the goal is comfort, not cure, the benefits are less clear. Let's address the factors that influence which setting is appropriate. Quality of life goals that prioritize comfort suggest home care. Quality of life goals that prioritize medical readiness for any possible crisis suggest hospitalization. The cat's personality affects how much the cat will be distressed by hospitalization. Cats who are already anxious, who become stressed by veterinary visits, or who struggle with unfamiliar environments often show significant distress with hospitalization that negates the medical benefits. The family's capacity is critical. Home care requires family members available to provide care, to monitor the cat, and to handle emergencies. If no family members are available for these duties, hospitalization may be necessary. Expected timeline affects the decision. If the cat's death is expected within days, home care may be more feasible. If the cat's decline is expected to last weeks or longer, hospitalization may be more sustainable. Medical complexity, including need for frequent medication adjustments, continuous monitoring needs, or likelihood of acute crises may make hospitalization more appropriate despite the cat's distress. Financial capacity affects whether hospitalization is possible. If the family cannot afford hospitalization, home care becomes the only option. The family should not go into debt for end-of-life hospitalization unless the family believes the medical benefits justify the cost. The hybrid approach is possible where the cat remains at home but has frequent veterinary visits or consultations to monitor condition and adjust care. This provides some of the benefits of professional monitoring while maintaining the comfort of home. Euthanasia location can be planned separately from where the cat spends their final days. Many cats spend their final days at home and are brought to a clinic for euthanasia. Other cats can be euthanized at home by a veterinarian if the family prefers. Home euthanasia has become more available through veterinarians who offer house call services for euthanasia. The cat dies at home with family present, in familiar surroundings, in a peaceful setting. The verdict. Home end-of-life care provides psychological comfort and emotional support that hospitalization cannot match, and is appropriate when the goal is comfort and when the family has capacity to provide care. Professional hospitalization provides medical monitoring and intervention capability that home care cannot match, and is appropriate when the cat needs acute medical management or when the family cannot provide home care. The best choice depends on the specific cat's condition, the family's values and capacity, the expected timeline, and what will create the most peaceful death for the cat and the most meaningful closure for the family. Most cats with terminal illness show better emotional and behavioral adjustment in home care than in hospitalization, despite the family's concerns about inadequate medical monitoring. If you choose home care, prepare in advance. Discuss with your veterinarian what to expect, what to watch for, when to call, and how to recognize that your cat is suffering beyond what can be managed comfortably. Have pain medications on hand. Have a plan for emergency care. Know how to access your veterinarian after hours. If you choose hospitalization, recognize that your cat will be distressed by the unfamiliar environment and will spend significant time without family presence. Visit as frequently as allowed. Ask about your cat's comfort level. Be prepared to reconsider if your cat is showing severe distress. Many families report that home care, despite being emotionally difficult, felt like the right choice because their cat was comfortable and peaceful. Other families report that hospitalization was necessary because their cat's condition required professional monitoring. Do not choose hospitalization simply because you are afraid of death at home. Death at home is not traumatic for the cat in the way that hospitalization can be traumatic. Home death with family present is often peaceful. Do not choose home care if you do not have the capacity to provide it. A cat in pain with no one to help is suffering. If you cannot be present, if you cannot monitor the cat, if you cannot access emergency care, hospitalization may be more appropriate despite its drawbacks. The most important factor is that your cat experiences comfort and peace at the end of life. Whether that happens at home or in a facility matters far less than whether the cat is comfortable, whether pain is managed, and whether the cat's final days involve presence of loved ones, whether in person or through regular visits. Give yourself permission to choose the setting that works for your family. Whether that is home or hospital, what matters is your intention to provide comfort and to be present for your cat as much as possible as they approach death. Comparison 9. Medication side effects versus benefits, continuing versus stopping. As cats reach end of life, they are often on multiple medications prescribed months or years earlier for chronic conditions that are now terminal. Antibiotics that may cause nausea, medications that affect appetite or energy, pain medications that have significant side effects, thyroid medications for hyperthyroidism, cardiac medications for heart disease, all continue until the owner or veterinarian makes an explicit decision to stop. The decision to continue or stop medication becomes complex because each medication offers some benefit while also creating side effects, and the cost-benefit analysis changes as the cat approaches death. The contrast is between continuing medications based on the logic that they were prescribed and must be continued, and deliberately stopping medications where side effects outweigh benefits in the context of terminal decline. This comparison examines what happens with medications in end-stage disease, how to assess whether benefits justify side effects, when continuation is appropriate versus when stopping is kind, and how to have the clarity conversations with your veterinarian about medication goals. Let's start with why medications continue through end of life. Prescription momentum is that medications are prescribed for specific conditions and continue indefinitely unless explicitly stopped. Many owners and veterinarians continue medications out of habit or assumption that the medications should continue rather than actively assessing whether they remain appropriate. Fear of stopping is that owners fear that stopping a medication will cause the cat's condition to worsen. The owner believes that the medication is preventing something bad from happening and that stopping it will cause that bad thing to occur. The extended life question is whether medications are extending life meaningfully or whether they are merely extending the dying process. Medications that extended life significantly when the cat was years from death may extend life only by days when the cat is terminal. Symptom management is appropriate when medications manage symptoms that diminish quality of life. Pain medication for arthritis, pain, nausea medication for kidney disease symptoms, cardiac medications for heart symptoms. These have clear benefit if the cat's quality of life improves on the medication. The unclear benefit is when medications are continued for prevention or for managing subtle problems that no longer matter in the context of terminal disease. A medication preventing thyroid symptoms is less important when the cat is dying from cancer. The veterinarian's role is that veterinarians often do not initiate conversations about stopping medications because the veterinarian assumes the owner wants the cat to receive all possible care. Many veterinarians will stop medications if asked, but do not propose stopping unless explicitly asked. The owner's role is often passive. Owners continue medications because they were prescribed and do not question whether continuation is still appropriate. Owners do not know they have the right to ask the veterinarian about stopping medications. The guilt factor is that stopping medications can feel like the owner is giving up, is not fighting for the cat's life, is hastening death. This guilt often prevents owners from stopping medications even when the cat's quality of life would improve by stopping. Now let's examine specific medication dilemmas in end-stage disease. Pain medications often have side effects including sedation, nausea, or appetite suppression. The question is whether pain control justifies the side effects. Late in terminal disease, pain control becomes increasingly important, and side effects become less important because the cat is not expected to recover. Antibiotics may be prescribed repeatedly for recurring infections. In end-stage disease, treating recurring infections may merely extend dying rather than supporting life. The side effects of antibiotics, including gastrointestinal upset, may outweigh the benefit of treating an infection that is not causing obvious suffering. Cardiac medications for heart disease continue in many cats, even when the heart disease is clearly progressing and medications are no longer extending life meaningfully. The question is whether the medication's side effects of reduced appetite or lethargy are justified by minimal life extension. Thyroid medications for hyperthyroidism continue in cats, even when the cat is dying from other causes. The medication manages thyroid symptoms, but adds burden to an already compromised cat. Kidney disease medications, including phosphate binders, supplements, or other medications, continue in cats with advanced kidney disease, where these medications may provide minimal benefit. Neurological medications for seizure control or behavior management continue even when the cat is dying, raising the question of whether continued seizure prevention is important in a cat approaching death. Appetite stimulants that may cause disorientation or other side effects continue sometimes in cats with no appetite, raising questions about whether stimulating appetite when the cat is not interested is kind or is forcing appetite against the cat's body signals. Let's address how to assess medication benefit versus side effects. Symptom assessment involves observing whether the medication actually controls the symptom it was prescribed for. If a pain medication does not noticeably reduce pain behavior, its benefit is unclear. If an antibiotic does not resolve infection symptoms, the benefit is questionable. Side effect observation involves paying attention to whether the cat seems to feel worse on the medication than without it. Sedation, nausea, reduced appetite, behavior changes, or reduced engagement may indicate side effects that outweigh benefits. Timeline consideration is that in early disease, medications that extend life years justify side effects. In terminal disease, where life extension is days or weeks, if any, side effects become increasingly important relative to minimal benefit. Quality of life weighing involves honest assessment of whether the medication improves the cat's daily experience. If the medication allows the cat to be more alert, to eat better, to move more comfortably, then it improves quality of life. If the medication creates lethargy, nausea, or other problems while providing minimal improvement in the cat's actual experience, then it diminishes quality of life. The conversation with your veterinarian should include explicitly asking about each medication. What is this medication intended to accomplish? Is it working? What are the side effects? If we stop this medication, what would happen? Would the cat's quality of life improve or worsen if we stopped? The clarity goal is to know for each medication whether it is helping or harming the cat's quality of life. Many owners are surprised to find that stopping a medication the cat has been on for years results in visible improvement in the cat's energy, appetite, or engagement. The trial approach involves asking your veterinarian whether you could try stopping a medication for a period and observing whether the cat improves or worsens. If the cat improves without the medication, the decision to stop is easier. If the cat clearly worsens, the medication's benefit is clear and continuation is appropriate. The symptom focus means that late in disease, medications addressing active suffering should continue. Pain medications, nausea medications, anti-anxiety medications. If these address current suffering, they should continue. Medications addressing prevention or managing asymptomatic problems should be questioned. The essential versus optional distinction is that some medications are essential to the cat's comfort and should continue, while others are optional and should be reconsidered. Pain medication is usually essential. Medication preventing thyroid symptoms when the cat is dying from cancer is usually optional. Let's address what stopping medications actually means. Stopping a medication does not cause death unless the medication was preventing imminent death. Stopping thyroid medication does not kill the cat. Stopping prevention medications does not cause the cat to die sooner unless the cat was on life support medications like cardiac medications for severe heart disease. The fear is often greater than the reality. Owners fear stopping a medication will cause sudden worsening. In most cases, stopping a medication that provides minimal benefit results in the cat feeling better due to reduction in side effects. The timing of stopping should ideally be when you have time to observe how the cat responds. Stopping multiple medications at once makes it hard to know which medication caused any observed changes. Communication with the veterinarian is important so the veterinarian knows which medications have been stopped and can monitor for any actual problems that result. The verdict: continuing medications in terminal disease should be based on active assessment of benefit versus side effects, not on habit or assumption that prescribed medications must continue. Many medications offer minimal benefit in terminal disease while creating side effects that reduce quality of life, and stopping them improves the cat's comfort. Pain medications and medications addressing active suffering should generally continue because their benefits are clear. Prevention medications should generally be questioned because their benefits are unclear in the context of terminal disease. The clarity conversation with your veterinarian about each medication's goal, whether it is being achieved, what the side effects are, and whether continuation is improving or diminishing quality of life, is essential. If your cat is on multiple medications and is approaching end of life, explicitly ask your veterinarian which medications are truly necessary and which could be stopped. Many veterinarians will stop medications when asked, but do not propose stopping unless explicitly asked. Do not feel guilty about stopping medications. Stopping a medication that is causing side effects without providing meaningful benefit is compassionate, not abandonment. If your cat becomes more alert, eats better, or seems more comfortable after stopping a medication, this is evidence that the medication was harming quality of life and its removal was appropriate. Observe your cat carefully if you stop a medication. If the cat clearly worsens, or if pain or other symptoms that were being managed reappear, the medication's benefit becomes clear and can be restarted. Many owners report that stopping medications late in their cat's life and seeing improvement in their cat's engagement and comfort was one of the most important decisions they made. The fear of stopping was worse than the actual outcome of stopping. Pain management should remain a priority and pain medications should continue or be increased as needed. Other medications should be reconsidered based on their actual benefit to the cat's experience. Late in terminal disease, the focus should shift from preventing future problems to managing current comfort. Medications should serve comfort, not prevention or life extension. Comparison 10. grieving and moving forward. Immediate versus taking time after a cat dies, owners face pressure from themselves, from family, from society about how quickly to move forward. Some owners immediately adopt a new cat, immediately clean and reorganize the spaces where the dead cat lived, immediately attempt to return to normal routine and close the chapter on the cat's life. These owners experience relief and the sense that moving forward quickly honors the dead cat by replacing the sadness with new companionship. Other owners take weeks, months, or even longer before getting another cat or before clearing away the reminders of their cat's life. They honor their cat's memory through deliberate grieving, through taking time to process the loss, through refusing to rush the recovery process. The contrast is between societal expectations that you should move on quickly and personal needs for adequate time to grieve. This comparison examines what grief actually requires, what moving forward quickly accomplishes, what taking time accomplishes, how to recognize whether your grief process is healthy when getting a new cat is appropriate versus premature, and how to honor both your cat's memory and your own emotional needs. Let's start with societal pressure and what it creates. The cultural message is that pet loss should be grieved briefly and then moved past. The cultural narrative is that the pet was a possession that is replaced, not a family member that fundamentally changes the household. Owners are expected to be over it relatively quickly. Family pressure sometimes comes from well-meaning family members who do not understand the depth of pet loss and who offer comments like, "It was just a cat," or "You can get another one." These comments, though intended as comfort, minimize grief and create shame in the grieving owner. The rush to replace comes partly from genuine pain. The house feels empty. The daily routines feel pointless without the cat. The grief hurts intensely and the owner wants it to stop. Getting a new cat offers the promise of ending the pain. The false hope is that a new cat will fill the empty space and will solve the grieving. A new cat may help rebuild routine, but cannot replace the specific cat who died. The grief must still be processed. Skipping that process often means the grief resurfaces later. The guilt about grief is that owners sometimes feel they should be strong and should move on quickly. Owners internalize the message that grieving a cat for months is excessive or unhealthy, when in fact adequate grieving often requires months. The mistaken belief is that the more quickly you move on, the more you honor the cat. In reality, honoring the cat's memory often requires taking time to process the relationship and the loss. Now let's examine immediate moving forward and what it involves. Immediate adoption of a new cat within days or weeks after the death of the previous cat. The owner seeks out a new cat quickly to fill the empty space and to resume having a cat in the home. The behavioral motivation is that grief is painful and difficult, and the new cat offers the promise of returning to the way things were. The owner's intention is to return to normalcy and to stop hurting. The practical benefit is that having a cat in the home provides structure and purpose that grief alone does not provide. The daily rhythm of feeding, playing, caring for a cat provides psychological benefit. The risk is that the new cat is sometimes viewed through the lens of the dead cat. The owner compares the new cat to the old cat. The new cat does not measure up. The owner projects unresolved grief onto the new cat, creating a relationship that starts with the new cat as inadequate replacement rather than as their own unique being. The guilt sometimes arises later when the owner feels they moved on too quickly or that getting a new cat was disloyal to the cat who died. Many owners later report that they wish they had taken more time before getting the new cat. The relationship quality is sometimes compromised because the owner has not adequately grieved the previous cat and is therefore not fully present with the new cat. The new cat deserves an owner who is ready to bond with them as a unique individual, not as a replacement. The cleanup may happen immediately, with the owner removing reminders of the dead cat, washing the dead cat's bedding, putting away toys and dishes. The owner wants to erase the daily reminders that trigger grief. The problem with immediate cleanup is that the reminders are not just triggers for pain, they are connections to memory and meaning. Removing them too quickly can result in later regret. Many owners wish they had kept something of their cats, a toy, bedding, a photo. The fast recovery that immediate moving forward promises often does not materialize. The grief still happens, just less openly. The owner often feels guilty about the new cat while still processing loss of the old cat. Now let's examine taking time and what it involves. Deliberate grieving, where the owner takes weeks or months to process the loss before getting a new cat or before dismantling the reminders of the dead cat. The space creation, where the owner allows themselves to feel the grief, to acknowledge the loss, to miss the cat without immediately trying to fill that absence. Keeping reminders of the dead cat, including photos, toys, bedding, or other items that maintain connection to memory. These reminders hurt initially, but eventually become comforting records of the relationship that existed. The memorial space, where some owners keep a small memorial with photos and reminders of the cat. The space serves as acknowledgement of the cat's importance. Delayed adoption, where the owner takes time, sometimes weeks or months, before getting a new cat. The owner has processed the loss of the previous cat and is genuinely ready to welcome a new cat as a new individual, not as a replacement. The relationship quality is often stronger when the owner has adequately grieved the previous cat. The new cat is not burdened with being a replacement. The new cat is welcomed as their own unique self into a home where the owner has processed the loss adequately. The guilt reduction comes from honoring the previous cat's memory through deliberate grieving, rather than through rushing past the grief. The journal or memory creation, where some owners write down memories, photos, stories about their dead cat. The act of recording memories honors the cat and processes the loss. The understanding that grief is not weakness, but evidence of how much the cat mattered. Taking time to grieve honors both the cat and the owner's capacity to love. The processing timeline that grief genuinely requires time. The initial acute grief may last weeks. The extended grief processing may require months. Only after real time has passed can the owner genuinely be ready for a new cat. Let's address healthy versus unhealthy grief. Healthy grief includes intense pain initially that gradually decreases over time, continues to honor the cat's memory while gradually moving forward, maintains ability to function, eating, sleeping, working, includes sadness but not clinical depression, and eventually allows positive memories without intense pain. Unhealthy grief includes grief that becomes worse over time, grief that prevents basic functioning including eating or sleeping, grief that turns into depression requiring professional help, grief that turns into guilt or anger towards self or others, and grief that becomes stuck and does not progress toward acceptance. The professional line is when grief becomes so intense that it affects mental health or functioning. Talking to a therapist or counselor can help. Pet loss is real loss and is worthy of professional support if the grief becomes overwhelming. The validation that grieving a cat for months or even longer is normal and healthy. Cultural messages suggesting brief grief is inadequate. Your cat was your companion for years. Grieving appropriately takes time. The timeline variation is that some people grieve intensely for weeks and process relatively quickly. Others need months or longer. Neither is wrong. The timeline is individual. Let's address when getting a new cat is appropriate. Ready for new cat when you have processed the loss of the previous cat adequately. You can welcome a new cat as their own unique individual, not as a replacement. You have taken time to clean and reorganize as needed. You have thought through whether getting another cat is what you want or what you think you should do. Your grief has moved from acute pain to acceptance with sadness. You are ready to commit to a new cat with full presence and attention. Not ready when. Getting a new cat is an attempt to escape or avoid grief. You are not sure whether you want another cat, or you are doing it because it is expected. You are still comparing any potential cat to the cat who died. You have not had time to process the loss adequately. You are getting a new cat to make others uncomfortable with your grief. Stop. The house still feels like a shrine to the previous cat, and the new cat will feel like an invader. The verdict, immediate moving forward, often serves the owner's desire to escape grief rather than serving the owner's or the cat's best interests. Taking adequate time to grieve honors the dead cat's memory and prepares the owner to genuinely welcome a new cat as a new individual rather than as a replacement. Healthy grief requires time, weeks to months, depending on the relationship and the owner's nature. Rushing this process often means the grief resurfaces later and compromises the new relationship. You do not need permission to grieve your cat for months. The cultural message that this is excessive is wrong. Your cat was important. Your grief is appropriate. Do not feel pressure to get a new cat quickly. The empty house is hard, the missing routines hurt. But filling that immediately often prevents the processing that allows genuine healing. If you are considering getting a new cat, ask yourself honestly whether it is because you are ready for a new cat as their own individual, or whether it is because you cannot bear the pain of the empty space. If it is the latter, take more time. Keep reminders of your dead cat, photos, toys, bedding. Do not erase them immediately. These connections to memory become sources of comfort rather than pain as time passes. Many owners wish they had kept something they later disposed of in the acute grief. Honor your cat's memory not by replacing them quickly, but by taking time to acknowledge what they meant to you. Journal. Create a memorial. Talk about memories. The act of honoring is part of healthy grieving. If your grief becomes overwhelming, if it prevents you from functioning, if it turns into depression that does not improve with time, seek professional support. Pet loss is real loss and is worthy of therapeutic help. Many owners report that they regretted rushing to get a new cat and that they should have taken more time. Very few owners regret having taken more time than they thought they needed. The memory of your cat is not diminished by moving forward. Moving forward after adequate grieving honors the cat by ensuring their place in your life history while allowing you to rebuild and to potentially welcome new companionship. Take the time you need. Your cat was worth the time. You are worth the time. The grieving is the last thing you can do for your cat. Do not rush it. Closing. End of life, aging, and chronic conditions. So there you have it, the 10 decisions that shape your cat's final chapter. These are not decisions that will be easy. These are not decisions where one choice is clearly right and another is clearly wrong. These are decisions where you must know yourself, know your cat, know your values, and make peace with choosing what you genuinely believe is right, even when other options seemed possible. Let's recap what we have covered in this part and what the overarching principles are. The first principle is that your cat's death is not a medical failure that requires aggressive intervention to prevent. Your cat's death is an inevitable part of life that can be managed with dignity and comfort, rather than with resistance and desperation. The goal in end-of-life care is not to extend life at all costs. The goal is to ensure that the life remaining is lived well. The second principle is that recognizing suffering is your primary responsibility and your primary gift to your cat. Your cat cannot tell you they are in pain. Your cat cannot tell you they want to die. Your cat cannot advocate for themselves. You must learn to see what your cat is experiencing beyond what the cat can communicate verbally. You must develop the skill of reading subtle pain, recognizing when quality of life has declined below acceptable, understanding when your cat is ready to let go. This skill, this attention, this presence is one of the most important things you will provide as a cat guardian. The third principle is that acceptance is not failure. Accepting that your cat will die, accepting that treatment cannot fix everything, accepting that quality of life has declined beyond what can be managed, accepting that your cat's time is ending. This acceptance is not giving up. This is clarity. This is love. The owner who can accept when continuing is hurting rather than helping, who can let go of the fantasy of recovery and focus on the reality of comfort, who can make peace with mortality. This owner provides the greatest gift a cat can receive at the end of life, The fourth principle is that guilt is a companion to these decisions, but guilt does not mean you made the wrong choice. You will second-guess yourself. You will wonder if you did enough, if you should have done more, if you should have waited longer, if you should have acted sooner. Almost every cat owner who navigates end-of-life decisions experiences guilt. The guilt is evidence that you cared deeply, that your cat mattered to you, that the decision weighed on you. The guilt does not mean you failed. The guilt means you loved. The fifth principle is that your cat's final days are not measured by how long you can keep them alive, but by how well you can keep them comfortable. The final days that will remain with you forever are not the days of treatment and intervention and fighting. The final days that bring peace are the days where your cat was comfortable, where your cat was not suffering, where your cat was present with loved ones, where your cat experienced dignity at the end of life. These are the days you will remember with sadness, but also with peace. The other days, the days of forced treatment, the days of suffering your cat could not escape, the days where you prioritized your need to keep them alive over your cat's need to not hurt. These are the days you may regret. Make sure your final days are days of peace. The sixth principle is that the decisions in Part 9 are deeply personal. There is no universal right answer that applies to all cats. What is right for your 20-year-old cat with kidney disease and arthritis may not be right for someone else's cat. What you are capable of emotionally and physically and financially may be different from what another owner can do. What your cat needs and prefers may be different from what another cat needs. Judge yourself and your decisions not against external standards, but against your own values and your own cat's actual experience. The owner who chooses quality of life focus is not better or worse than the owner who chooses aggressive intervention. The owner who grieves for 6 months is not better or worse than the owner who grieves for 1 month. What matters is that you are making conscious decisions based on your values and your cat's needs, not making automatic decisions based on assumptions or guilt or pressure from others. Now, as we move toward the final part of this series, I want to acknowledge what you have accomplished by watching this far. You have watched 9 parts covering the foundational decisions that shape a cat's entire life from the moment they enter your home. You have learned that cat care is not one size fits all. You have learned that decisions should be based on your specific cat's needs and your specific circumstances, not on universal rules about what cats need. You have learned that the best cat guardianship comes from understanding your cat as an individual, from observing their behavior and responding to what you observe, from making intentional decisions rather than defaulting to convention. You have learned that even when decisions are hard or when guilt clouds your choices, you can make decisions that honor both your cat and your own values. Part 10 covers the final category of decisions, multi-cat households and special situations where cats have complex needs, where multiple cats have competing needs, where the owner's capacity is limited, where perfect solutions do not exist and compromise becomes necessary. These are the nuanced real-world situations where principles from parts 1 through 9 must be applied to messy, complicated circumstances where no choice is ideal. Part 10 will be the last part in this series, and it will bring together everything we have discussed into framework for making decisions in complex situations. After Part 10, you will have the complete framework for understanding the major decisions that shape a cat's life, from the foundational choices in Part 1 all the way through the final decisions in Part 9 and the complicated situations in Part 10. If you found this part helpful, if the conversations about end-of-life care resonated with you, if you felt seen and understood in the difficulty of these decisions, please click the like button. Many people struggle with end-of-life decisions for their cats and feel alone or guilty. Your like helps other cat lovers find this information and feel less alone in these conversations. Subscribe to the channel if you have not already so you do not miss Part 10, the final installment where we address multi-cat complications and special situations. And if you have a cat facing end-of-life decisions, if you are grieving the loss of a cat, if these topics hit close to home, please know that you are not alone. Thousands of cat owners navigate these decisions every year. The fact that you care enough to seek out information, to think carefully about your decisions, to try to do right by your cat, this matters. Your cat is lucky to have you. Thank you for watching Part 9, and we will see you in Part 10, where we wrap up this framework and address the real-world complexity of multi-cat households and special situations that do not fit neatly into categories.